AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we teach you how to live a longer and healthier life. I'm Lorena Anderson, your life and energy coach, and we're being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. And if you have any questions about home health care for All County Healthcare, please give them a call at 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have. We're here live on 1470 AM and also 95.3 FM. And just in case you can't be with us for the whole show, we're going to be airing it again on 95.3 FM Tuesdays at 11 o'clock a.m. and 3 o'clock p.m. So join us at 80 Point, and even if we can't answer your questions on air, you can always give us a call at All County Healthcare, 888-717-7170. Well, thanks for joining us today. We're also live on All County Healthcare Facebook page. So we're streaming live, and also wwnnradio.com. You can find us there as well. So we're thrilled to have you here tonight, and we've got some really special guests for you today. And I'd like to start, our first conversation is going to be about men's health relating to ED, erect dysfunction. So we've got a professional that's on air with us today, Lou Biazzi, and he's going to be talking to us about ED.
NPE.
And NPE, and also where we can find help. Because I just have to say that this is not just a men's problem. This happens to be a woman's problem as well. And the reason why I say that is that good, healthy relationships are based on a good, healthy sexual life. So, if a man feels as if he cannot perform the way he used to, it impacts that relationship, and it impacts the woman as well. So, without any further ado, hi, welcome, Lou. How are you?
Thank you for having me.
Yes, absolutely.
A few weeks ago we had Dr. Biazzi on. Dr. Biazzi, very similar name to mine, but he is a urologist, a well-known urologist in the Palm Beach County, and he indicated, how ED is a major problem. Mm-hmm. In men over 50, he says 50% have a problem. Men over 60, 60%.
Really?
And men over 70, 70%. So we're all going to fall into that category of ED. Mm-hmm. Cialis and Viagra, Levitra, has made a tremendous impact on the male population as far as them regaining their sexual desires and being able to perform. Mm-hmm. But there's a lot of individuals who are suffering from either prostate cancer, diabetes, where Cialis or Levitra or Viagra just doesn't work for them.
Right.
And there's an alternative. The alternative is, I'm going to tell you, is that Dr. Koba, a well-known doctor and board-certified anti-aging physician, opened a clinic in Lauderdale Lakes. And I got to tell you, it's amazing. He put a program together for less than $3 a day. You can get your whole sex life, have amazing sex again for $3 a day. I mean, it's amazing because what's happening right now.
That's pretty amazing.
There's a lot of clinics out there that are selling testosterone and selling ED or promoting ED, promoting testosterone, and they're in the thousands of dollars. Mm-hmm. I mean, you can get a whole year's supply for $900. I mean, a whole year worth of sexual gratification for $900. And, he's asked me to tell them about what's going on in the ED situation.
Excellent. Well, let's go back and let's talk about what some of the differences are. Why doesn't Viagra work anymore? Why can't people use Cialis? What are some of the issues that they deal with where, that is no longer viable for them?
Well, some of the gentlemen who try it, they get tremendous headaches, they get pain, just doesn't work. It all depends upon the blood flow to the penis, and it just doesn't give them sufficient blood flow where they can have sexual intercourse and penetrate the woman like they like to. So a lot of women call us for their husbands or for their boyfriends.
That's exactly my point. Yeah, that's what I was saying. This isn't just a male issue. This is a relationship issue. I mean, males and females.
It creates a major problem in the relationship or in the marriage. And so women call. Can you do anything? Can you do anything for my husband? Can you do anything? We have young women calling, for younger men, where they have premature ejaculation, where they get excited and they really can't satisfy that female. And the younger women are calling, what can we do? And they try Cialis and Viagra, right?
Yes.
The whole concept of the new process is that Dr. Koba now says if you go to his clinic and you don't get results, you get 98% success rate.
Wow.
If you don't get any results, there's no charge. Matter of fact, right now, he's offering a complimentary visit.
Wow.
Where all these other doctors are charging X amount of dollars, he's offering you a complimentary visit to go to his clinic. Now, if you want to get in touch with him,
that's what I was going to ask you. Yes.
954-513-4646. That's 954-513-4646. Or go to his web. It's www.conciergemen's.
Oh.
So that is his. That's Dr. Koba's website, and he's willing to talk to anyone to help him.
Yeah.
And he's and he's found out when men go to him. He's found out they have high blood pressure.
That's what I was going to ask you.
A lot of these men haven't had a checkup in a long time. They know what's wrong. He's found
diabetes.
They borderline diabetics.
Yeah. And then heart condition as well. I mean, a lot of times, if you have a heart condition, they won't allow you to have any of the Cialis or Viagra.
And one of the things he said, this doesn't affect you, basically, and all the drugs that they use are all FDA approved. So, it's worth going there.
Yes.
Before you go to any other clinic, I think you should check him out. A lot of these gentlemen now are getting stuck with large bills, about $5,000, $4,000, $6,000, and they get quite upset because,
there's no guarantee.
There's no guarantee.
What do?
Right?
They can give them a Playboy magazine as well, right?
So and they always want their money back when they say, "Oh, the guy ripped me off, or the guy did this." The guy did that. Here, there's no contracts to sign. You get it when you need it. Just buy enough medication as you need. And he has 3 programs. I think he offers a 6-month, a 3-month, and a 12-month program. But again, ED is a major problem.
It is. Yeah.
I would say it affects 70% of men over 50, some form or another. That's why Cialis and Viagra can make all those commercials on TV. Spend fortunes of money on it. And I think a Cialis pill right now is up to almost $50.
Oh, you're kidding.
$50, yeah. I think it's about that, $30, $40, $50. But it gets quite expensive.
Yes, it does. Yes, it does. And it so interferes with a good, healthy relationship because there's nothing better than having a great relationship with somebody and great sex.
Right.
I mean, I know of a lot of individuals that end up in divorce because there's no more sex.
Oh.
And no fault of one part or the other, but I know that for a lot of men, if they have situations where they can't perform, they shut down.
Well, they don't only shut down; they lose they feel they lose their manhood.
That's my whole point. They shut down.
When you lose your manhood, you feel I can't satisfy this woman, and everything becomes argumentative, right?
Exactly.
Now everything creates He knows he can't perform.
Yep.
Right. We've had sexologists on this program many times talk about female sex, and as elderly people get older, they still have a desire of warmth, closeness, affection.
Do you know something? They're having good healthy couples. They're having sex in their 70s, their 80s, their 90s.
I was just with a gentleman yesterday. He said, Lou, I'm 73 years old, and I finally met a woman. I have great sex with her. I said, you do? He says, absolutely. And he says, it's just amazing. He says, and she's 72. So imagine, at 73 and 72, they're having great sex.
Yes.
And it's keeping them together.
Absolutely.
And he's like almost completely now found himself again. They go and they get new clothes.
I know, I love it. You feel alive. You feel youthful. Right. It's very important to allow yourself to feel that sexuality and the sensuality as well.
I don't care what age you are.
I agree.
Right?
Well,
I mean, above
Thank you.
18, 20. I mean, as you grow older, I don't care what age you are, when you pass your 30s, 40s, 50s, 60s, the testosterone level starts to decrease in the men.
Right.
The estrogen level starts to decrease in the women. And so the desires change a little.
Yeah.
But they still have an urge. Men still want to say, I can perform.
Yeah, exactly.
They never admit they have an ED problem.
Well, ego.
Men, it's all ego,
It's all ego.
So I say, men, if you have a problem, listen, whether you had a heart problem, you go to a doctor. If you have a prostate problem, you go to a doctor. You have a diabetic problem, you got to go to a doctor. If you have an ED problem, it can be solved today.
Yes.
If you tried Cialis and Viagra and didn't work, this problem can be solved. Don't be ashamed. This happens to all of us. So go in, ask them, what can I do about my problem? And if women are listening out there and you think your husband has that problem, call. Make an appointment. Come on in with them. And Dr. Cole will explain to you the effect that it has. And I'll tell you, I mean, the program he has, it's a program that, I shouldn't be, how do I say this? But, the penis can stay erect for 30, 60, 90 minutes, whatever you prefer. And it's just amazing. I mean, I think...
Now, does that stop it also from premature ejaculation?
It absolutely stops premature ejaculation, because what happens at that particular time, you can satisfy the woman. A lot of men, well, how do I say
Spit it out.
How do I say it in a nice way? A lot of men will have an orgasm prior to the woman being satisfied, and now there's nothing more you can do. She's frustrated, right? And he thinks he's a great lover. Most men think they're a great lover after they have an orgasm. Most women say, "No, you're not a great lover."
Hello.
Is that all there is?
Yeah. Reminds me of a song.
So anyway, the story is, the problem, you have it. Don't be afraid to admit it. Go in and see him. It's not that expensive anymore. You've gone to other clinics. Try Dr. Koba. Try Concierge Men's. You're not going to be charged any finance charges. You're not going to be charged large fees of thousands of dollars.
What's the telephone number there again?
It's 954-513-4646. Or on the web, it's www.conciergemen's. Great website. It tells you everything there is about it. Get to it. Look at it. And, make an appointment. It's not going to cost you anything. It's a free appointment. So come on and talk to him.
Now, do we know some of the other means through these programs that he uses? I mean, we're very familiar with the drug program. Is there any other programs? What else does he do to help the ED?
Well, first of all, you got to find the underlying problem. Right?
Okay.
Sometimes there's no cure to the point where if the man had an erection for 4 or 5 years, and the result is, there's multiple cures. There's of course, the Cialis, Viagra. There's other medication they can take, try orally. There's certain creams they can try to take to stimulate them. But he has a program where he does it. And the best thing is you go in and see him, because different men want different types of programs.
Or various programs work for different men. Not everything works for everybody, as we well know.
I mean, you get Cialis, you get Viagra, you get what they call Troges. You can get different grades. You can have something formulated for you in a different grade. So it depends what you want. And see what's working for you. Right?
Yeah, exactly.
So when you find something you're comfortable with and works for you, and your manhood is back, guess what? You're back in the game.
Yeah.
As the guy says, I'm back in the game. Right?
Absolutely.
And the greatest thing is to be back in that game and have amazing sex again.
Absolutely. So I just want to take this time out at the moment to really thank All County Healthcare for bringing this show to fruition. I mean, they've sponsored this show for 7-8 months now, and they bring on professionals in their field, various doctors, and also individuals to teach us about Medicare and how important it is to be able to be on Medicare. Also, we had someone on for reverse mortgage. We had somebody on that was for a lawyer, a geriatric lawyer.
Elder care lawyer.
Yeah, elder care lawyer. So I just want to say thank you so much to All County Healthcare for providing this show to help educate us so that we know the choices that are out there for us, and also the doctors that specialize in certain situations, certain ailments. We know then where to turn and who to call. So I just wanted to say thank you to All County Healthcare for that. And if you have any questions about your, first of all, the guests that are on, or if you have any home health issues that you need help with, please give them a call at 888-717-7170. Ask for Maddie. She's waiting for your call, and she can help you answer any questions that you might have, or get in touch with some of the doctors. Even like Lou here, give him a call, ask for Maddie there, and he'll be able to hook you up to this doctor.
Before I get on, it's funny you're talking about home care.
Yes.
I'm a little familiar with that,
Are you?
And so what happened is, the result was I had a friend of mine, a lot of people call me, and they say, he's in the hospital now, he had throat cancer, and they said, they're going to order home health. Well, he got off of Medicare, and he joined another program, Blue Cross Blue Shield, and when he was on Medicare, he would get tremendous amount of home care. Mm-hmm. As they switched their plans, they get off the Medicare to save a few dollars. Well, that's great as long as you're healthy. HMO stands for Health Maintenance Organization. Mm-hmm. As long as you're healthy.
Then you have nothing to worry about.
I bought fire insurance. As long as you have no fire, you're saying, what do I need fire insurance for?
Right? Car insurance.
Right, same thing.
Yep.
So you've got a program called Medicare. You paid for it for years. It's the best program in the whole wide world for health care. Mm-hmm. I have to laugh at all these politicians as we're talking about, they're changing the program about Obamacare and Trump care, and
it's so confusing.
It's confusing now.
Yes.
So, let's call our Senate and say, let's forget Obamacare, let's forget Trump care, let's forget Medicare. Give us the same kind of coverage you got.
Amen.
Right?
I'm all over that.
Coverage you got.
Absolutely.
Mr. Vice President, Mr. President, Mr.
I totally agree with you.
Mr. Congressman. Mm-hmm. Why should they have better coverage? They work for us. We're the employer.
Well, guess what?
Why does the employee have better coverage than the employer? So let's all call them and say, listen, forget all these plans.
Absolutely.
We want to be the same thing you're on. When you get, we want.
Absolutely.
Isn't that a great idea?
That is a tremendous idea.
And that solves all the problems.
Yeah.
Or let's put them back on Obamacare. Or let's put them back on what the choice of plans we have.
Exactly.
Right? Then see how they'll change.
And yes, absolutely. Absolutely. But you were saying something really interesting just a second ago, though, about someone who was in the hospital with a throat cancer.
He has throat cancer. Now he's going to be discharged. He needs a lot of health care.
Yeah.
And it's very difficult for him to find the right provider to give him that kind of care. Because what happens, if I'm correct, under the Medicare guidelines, I think you have a 60-day episode. Mm-hmm. So what the nurse will do, they'll go and do they'll go an assessment and find out what you need. Mm-hmm. All right, if you need nursing care, if you need PT, if you need OT, it's done for you. Mm-hmm. When you're with some of these other companies, they'll authorize 2 visits or 3 visits or 1 visit. And every time you got to get authorization.
Yeah, you have to get a referral.
You got to get a referral and get authorization.
Right. And sometimes you can't even get to the doctor for a month or 2 months.
So, the whole thing is, if you got something that the government gives you, and you paid for all your life, I can't quite understand why I'd want to go with something that I pay for. The government spends 99 cents in every dollar, and then to get a company that's in for private to make a profit, right? Mm-hmm. I'd rather go with a company that's more into the medicine aspect of it, saying, here, we're going to give you this program, use it as you need it, than a company saying, we want to make a profit, okay? We sell you the insurance, but we hope you never use it. Because we don't want to spend the money on it.
Yeah.
It's like car insurance. Getting 2 accidents, you get no car insurance.
Exactly.
Right?
Exactly.
So you get sick twice. If they could throw you off, they would throw you off, right? Or if you had a pre-existing condition prior to Obamacare, you couldn't get Obamacare.
You're right. You couldn't get insurance.
And a young lady friend of mine, she had to, she basically had a form of breast cancer.
Wow.
And she couldn't find insurance after she got laid off. She couldn't find insurance.
Yeah.
She had to go back and she couldn't get a job, so she was out coverage for months.
Wow. See, I want that other insurance. I want the insurance that the president has, that the
That's
vice
what I
president
want.
has.
Same
Yeah,
here,
I want
see?
that insurance.
We want what they
I've
have.
wanted it for a long time.
We got to get what they have.
Yes,
Okay.
yes.
And I think it's a great program, right?
Yes.
But anyway,
But you
yeah.
bring up a really good point, though, and that is, part of the show is to teach you about your options, what you have, and what's best for you. So, what I'm hearing, correct me if I'm wrong, is that, yes, you can go with the HMOs and everything. However, once you get sick, you've got more problems than not. With Medicare, you've already paid into it. It's for years, and it's there, and it covers you, and not only that,
almost any and every doctor takes Medicare.
yeah, and then home health care then is covered as well,
Right?
For
DME, home health. If you have to go to a rehab facility with Medicare, the first thing they ask you when a doctor calls you, you go to the doctor's office for a new patient. What kind of insurance do you have?
Totally.
We don't take that, or we take this. We don't take that.
It's a nightmare out
Medicare
there.
they take.
Yeah.
So if you have cancer and you want to go to MD Anderson down in Texas, you go, they take it. You want to go into Boston to Mass General, they take it. You want to go to New York, they take it. They take it all over the world. But if you're sitting here with a Florida Blue Cross, and I don't mean to say Blue Cross is bad, it's good for
It
some
works
people.
for a lot of people,
Or
but
any other program.
65 and over, you might need one to look
It
at.
depends where you go and if they take it. Right?
Yes.
So, and if you have
And
to
it's
get-
tough for the doctors, too. The doctors have
Right.
to sit there and go through a whole list to see whether or not they take that particular plan. And they don't like having to turn people away because they don't accept their insurance.
Some of the doctors say, it's very difficult for the doctors to keep track of everything.
I know.
Everybody's
Yes.
cutting the cost for doctors. The doctor has a very difficult time today maintaining a standard of living he should have, right?
How about just
It's-
paying
it's-
off their doctor bills, their school
it's
student
ridiculous,
loans?
right? Yeah, I mean, look at the student loans. He's been there for years, right? If he specialized in there for years.
Yes.
Now, everybody thinks the doctor's getting rich. He's not getting rich. Doctors don't get rich in primary care, or they're working their fannies off, okay? It's they make a good living, but they deserve it.
Yeah,
okay?
they do, because they're saving people's lives.
Right.
And it's a high stress.
How do we get on this subject? We're talking about ED. How do we get on this subject?
Well, because we started talking about home health care, remember? All
Right,
County
that's
Health Care,
correct.
our sponsors. And I was just saying how thankful and grateful I am for them sponsoring the show so that we can bring this education to them, and whether it is ED, because that is a senior population, not all the time, but a majority of the time. Orthopedic specialists we had, orthopedic surgeons, we've had podiatrists on, we've had low vision eye doctors on, functional vision. I mean, we've had a multitude.
People specialize in Alzheimer's,
Yes,
dementia.
yes.
And that's another thing you face. As you grow older, who has dementia? Who doesn't have dementia? There's special things for dementia programs, right?
Yes.
And there's a lot of cures coming. Medicine is changing rapidly. And for us to stay abreast to it, you almost have to be an accountant or a lawyer to stay abreast. All the laws are changing.
And how are you supposed to know? Where do you find this education? And that's why
You don't know until you get sick.
exactly. And by that time, it might be too late.
When you get sick and you go in the hospital, then they're going to tell you, well, you had this program. Now, because you went to this program, you're not going to get this, this, and this.
Yeah.
Well, they didn't tell me that. Well,
And that's what
listen,
your friend is dealing with throat cancer.
Remember, when you're 65 and you are totally disabled, you're entitled to Medicare, right? Now, they don't come out and sell you. You just enroll. If you want another program, they send a salesman out. Right?
Here's the problem. If they're sending a salesman,
If they're
who's
sending
getting paid?
Who's getting the salesman getting a commission?
Yeah,
All right,
exactly.
so right off the bat, someone's going to get a commission.
Yes.
Medicare, there's no sales. We just enroll. No one gets a commission. That's an entitlement. It's something you earned.
Yes.
And you earned it because
And you paid for it.
Right. There's been existence since only 1963. 1963, Medicare came into existence, right? On the Social Security Reform Act. So it's amazing. It's not that old. 63, And everybody said the Kennedy and Johnson, listen, when you grow old, you're going to have insurance. And people at that time had to pay for it, and they didn't want to pay for it. They didn't get into it, but now it's taken out of your pay, Every month, every week, you're going to see a Medicare payment taken out of your pay. Mm-hmm. So if you're 18 years old and you're starting up the workforce, or 21, you just get out of college and begin in the workforce, you say, gee, I get that Medicare payment. Well, I'm not using it.
Mm-hmm.
Well, guess what?
Someday
you're
you will.
You're going to be use it. Yeah. So if you paid for it all those years, why do you want to take something different?
I totally agree with you.
You're trading in a Cadillac for Ford.
Yes, right? Yes, I totally agree with you. I know exactly what you mean. So let's go back on the subject, though, of ED, because I'd like to close with some additional information for any of our listeners out there that are dealing with that situation, and or any of the wives or the girlfriends that might be dealing with it as well.
Well, I'm sure wives have, somebody always said to me, hey, Lou, is there anything for women? Sure, there's things out there for women. So if you're a lady and you need something, consult your physician, consult somebody. There's some help out there for you. But if your husband is suffering from that, chances are he is, and you're trying to not to embarrass him, not to avoid it. Call for him, make an appointment.
Yeah.
Talk about it. Talk to him about it.
And not only that, but the doctor probably has some information for the females as well.
Listen, if you want to take your husband in, you're a male, go in and see him. You can go with your husband or your boyfriend or whoever you want to go in with, your mate, right? And men, if you want to come in, it's an all-male staff. Don't feel embarrassed. Mm-hmm. They'll treat you. They'll tell you what your problem is. And guess what? If they can't solve your problem, there's no charge at all.
Wow.
You can't beat that.
Yes.
It's a free visit.
Give them their information again, the telephone number, website,
it's the
his
Concierge Men's Wellness.
Okay.
Located 4800 State Road 7, Suite 103. The phone number is 954-513-4646. That's 954-513-4646. Or call on the website, go to the website, go to conciergemens.com.
Okay, super.
Listen, it's a pleasure being with you.
It is a pleasure to have you here. Thank you so much for taking your time out, because I do.
Pleasure.
I know how busy you are, and you really helped educate us. I know my listeners out there are really, really thrilled to have this kind of information, because it's so important. It brings life into you. It makes you smile. It makes you happy and joyous, and there's nothing more beautiful than that.
And men, get back in the game.
Yeah.
And have
get back in the
great
game.
sex again.
Yes. So we're going to break for a commercial. Stay tuned. Don't leave. We've got another doctor coming on, Dr. Amy. So we cannot wait to get a little information from her as well. We'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470 and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson. I'm your life and energy coach. And this is You and Your Doctor, where we teach you how to live a longer and healthier life. We're being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. So, welcome again. We're on 1470 AM and 95.3 FM. In case you can't listen to the whole show, we're going to air it again next Tuesday, at 11 o'clock a.m. and 3 o'clock p.m. So if you have any questions whatsoever for any of our guests, you can call All County Healthcare at 888-717-7170. Ask for Maddie. She would love to answer any of your questions. So I'm really excited. We've got another doctor on here, Dr. Amy, and she is going to discuss with us all about pulmonary
and critical care.
And okay, there you go. And welcome. It's great to have you.
Thank you so much.
Thank you. Thank you for being here.
Well, I just want to clarify for your audience that I am a doctor of nursing practice.
Okay.
So it's a little different. I'm also a nurse practitioner, and I work in conjunction with physicians. And I also teach. I'm a adjunct professor at Palm Beach Atlantic University.
Wonderful, wonderful. Well, I am thrilled to have you here, and I cannot wait to hear what you're going to share with us, because I want to be educated.
Well, there you go.
Yes.
Well, I think what the first thing that your audience should know is that nurse practitioners and physicians can do the same things.
Okay.
We can prescribe, we can treat, we can order diagnostic testing, we write prescriptions, the same kind of function. We are educated differently. I have 11 years of education. Physicians usually round about at 12.
Oh, okay.
So it's a little different as far as that's concerned. And our approach is more toward a nursing approach, where we are very much into the whole patient, not just the disease process.
That's what I was going to ask you, because as you were just describing there, I was my antenna went up and I said holistic, where you're dealing with the whole individual. And
because it's not just the diagnosis or the surgical incision. It's a lot more. It's like, well, what happens when you go home to your community? What happens when you are in your own environment? What happens when you're in the hospital and you don't understand? What do we do? How do we enhance what you need to know, or how you need to live in your community to make you have optimal healthcare outcomes and not come back?
Right.
That's the goal.
Right.
That's the goal.
Absolutely. And get you back up and running and able to experience the lifestyle of which you're accustomed to.
Exactly.
Gotcha.
So
Okay.
that's really a big focus of what we do. And I'm a doctor of nursing practice. So what we do is we're an implementation science aspect of nursing, where we go out and we do all these things with our patients to make, after we get evidence-based practice and we find out, is this really going to work? Does this really help? Or is this just looks really good on paper, but it's not so good in practice? So
okay.
That's what we do.
So you take the various theories and you put them into practice to see and test them to see whether or not.
Right. Then evidence-based, like for example, remember back in the day, it was babies were put to sleep on their bellies.
Yes.
Right?
Just in case. Yeah.
Right.
Exactly.
So through practice, we realized that's not a good thing. So now it's babies on their backs to sleep. So that took a long time to happen, because we didn't realize how important clinical practice is when we do research. So now we're kind of like on the other end of people do research and then we put it into practice and say, yeah, this is great, or not so much.
I see.
So
So it's more like evidence-based theory then.
Exactly.
Oh,
Exactly.
excellent.
So it's
Excellent.
really cool. It's really cool.
That is very cool. So who are some of your patients then that you see?
I teach nursing students in their senior and junior year of nursing school, university. And I teach medical surgical nursing 1 and 2, and I also teach complex care, which is critical care. So we see a lot of patients in intensive care. A lot of times we see a lot of cardiac patients and a lot of pulmonary patients. Patients who have either had a heart attack or patients who have an exacerbation of their respiratory problem, like chronic obstructive pulmonary disease. So we see a lot of patients with those kind of disorders, congestive heart failure, COPD, and stuff like that.
Okay.
So
stroke fit into that as
Absolutely,
well? Okay.
absolutely. We see a lot of stroke patients as well. So we get to see the gamut of what goes on. And what, like for example, patients with COPD, people don't realize how devastating it is just in our country. 120,000 people a year die in the United States alone just from
Really?
COPD. It's the third largest cause of death in our country.
Oh my God! No, I had no idea.
And it is also a disease, interestingly enough, it's the only chronic disorder that has increased in the amount of patients diagnosed, not only generally, but in women.
Wow. What is the determining factor? I mean, what have they done in their past to get
Usually,
this?
what happens with patients who have COPD is the primary reason is smoking.
Wow.
They have smoked, and therefore they have changed their lung situation and can no longer exchange oxygen appropriately, caused a lot of inflammation to the airway and to the lung parenchyma, the lung tissue itself, and therefore it causes them issues with airway obstruction.
Wow.
Yeah, so it's a rough. It's like a lot of the patients that we see are usually in the third and fourth stages of COPD, and it's like they tell me things like it's like holding your breath and trying to breathe.
Wow.
That's a hard thing to do.
Yeah, that is very hard.
So it's quite the challenge to try to care for these patients to bring them back to their optimal levels. And a lot of them still continue to do bad things like smoke or be around people with secondhand smoke. It's very frustrating sometimes as a clinician.
Well, that is very frustrating. So, audience, please, if you're out there and you're smoking, this is the result of what's going to happen if you continue. It is absolutely essential for you to stop, for you to quit smoking, number one. And, I hear a lot, oh, but I really enjoy it. Do you enjoy killing yourself, really?
But that's what it is. And I think it's important that you made a very good statement. It's not cutting down, because studies show that even if you smoke 1 or 2 cigarettes a day, it's the same thing as smoking 10 or 20.
Wow.
So you need to stop.
Yes.
You need to stop, completely stop.
Completely stop. It's absolutely imperative. COPD is one of those it's almost an epidemic, isn't it?
I think the fact that smoking is such a huge component in this nation, particularly with now, it's very attractive to young adults. And ironically, tobacco companies market
Oh, yeah, I know they
toward
do.
adults, toward women as well.
Yes.
Back in the day, remember Virginia Slims was, that cigarette, you've come a long way, baby. Yeah, it's
Well,
lung cancer.
I have to admit, I smoked when I was 16
Of
until
course.
I was 30, 31.
Of course.
And
of
then
course.
quit. And then smoked for another 3 years. And then, phew, that's
Yeah,
it.
I know. But that's the good thing about tobacco smoking and lung disease. If you stop, you decrease your chances of lung cancer and getting
Yes.
a chronic disorder significantly. So that's a really good thing. So
Yes.
it's never too late to stop.
It's never too late. And not only that, it will begin the healing process. I mean, the body is absolutely amazing.
It is.
And it knows how to heal itself. But you have to stop damaging it.
And again, that goes with diet too. When
Oh,
we
yeah.
tell patients who come in with heart attacks or come in with congestive heart failure because your heart's a pump and it's not pumping appropriately. So when it doesn't pump appropriately, your lungs fill up with fluid, and that's why they call it congestive heart failure, because you get congested. Now they're just using the term heart failure, where your heart doesn't pump appropriately, so you fill up with fluid. So we try to teach them things like don't smoke, how important diet is, minimizing your salt intake, making good choices. And I think
Getting away from the processed foods.
Exactly. Well, that's because it's full of salt.
Yeah, exactly.
It's funny because the biggest revelation is when you speak to a patient and you say, "What do you eat?" "I don't eat a lot. I have breakfast, lunch, and dinner, and a little snack in between." "Okay, what do you have for breakfast?" "Well, I usually like to open up a can of soup and have soup. Soup is loaded with salt."
Oh my God, it's like 100 milligrams.
Exactly.
I mean, 1,000 milligrams. Yeah.
So, or they're
1,200
like, "Well, I have a snack of cheese and olives in the afternoon."
Oh,
and they
goodness.
don't realize, even though it's like, I only have an ounce of cheese and maybe 5 olives, but it's loaded with salt.
It is,
and
yes.
that's really a detriment to patients with heart disease. As is smoking.
Yes. Or the fast foods.
Fast foods, or I'd
They're
love to go
killing.
to McDonald's every morning and have an egg McMuffin. It's low in calories. calorie. It may be low in calorie, but it's
But it's
loaded up with
salt.
salt.
Yes. Yes.
And sadly,
And processed.
oh my God.
You know, the
That's like
hamburger
not-
meat.
that's
The
not
hamburger
it.
meat
Well,
is all
not-
processed.
and we're not even sure that's all hamburger
Yeah,
meat.
yeah, I know.
But I think I think the key to any successful patient interaction is to understand that they're human and they're going to make mistakes and nobody's going to be perfect, and that's okay. Because I think when you have fear with the patient, they're not going to be honest with you, and then they're not going to be true to themselves, and then they may not even want to come back. And the
I
key
understand that,
thing
yes.
is you want that good relationship with your patient,
Yes.
so that they can tell you, you know what, I really like this. What can I do to change it? And
A lot
supplement.
of times, though, you don't hear that. You know,
Right.
they'll kind of hide out and say, "Oh no, I'm doing really good." You know, I just have one little egg. It's fried with tons of butter
Exactly.
and bacon. Oh, let's
I
not forget the
know,
bacon.
I know, it's really
and I'm
funny.
like, oh, that's all
But even silly
fat.
things
You know,
like that, people will tell me I use Pam. I'm like, okay, so how much Pam do you use? I go through a can a week. That's
my
not
goodness.
good. Pam should last you at least a month.
Yeah,
It's a
yeah.
little spray, not this continual thing. But I think,
Exactly.
you know what I think the most important thing, at least in my practice is that you establish a relationship with your patient and you make them feel comfortable, because we're not here to judge, we're here to help.
right? Well, and I understand that. You know, being a life and energy coach, if I judged by any stretch of the imagination,
Absolutely.
they would never come back and they would never heal. So I just asked some really powerful questions like, so how valuable is your life, number one?
Right.
What are you willing to give up in order to have your health? And you've got to ask those questions to get them start thinking, because they go on automatic. And it's the taste buds that is the driving
Right.
force there.
It's true.
And it's not their.
But I also think with any situation, everybody has their vice. Some people smoke, some people eat, some people do both of those things, or they drink alcohol, or they take drugs, or whatever the case may be. You have to determine what your patient's limitations are, so that you can approach it in a way that's not threatening to them, but yet opens
Exactly.
the door for them to change.
Well, you know something. If they're in the hospital and they've got COPD, I think that is a pretty good door opening.
Oh, you would think
Yes, I
that
would
is.
think.
You would think that is, as they ask you with their oxygen on, can I have a cigarette? People do that. It's a hard process. Change is difficult. It's a very difficult thing for people. People, even if it's bad, people fear change because they don't know what's going to happen.
Well, they do fear change, although I have to say that we're changing all the time.
Absolutely.
And we're always changing in increments. Like just sitting here talking with you, I've never had the opportunity of discussing anything, but you're changing my life right now.
Well, there you go. I'm
Yes.
so happy.
Well, that's what happens. Every interaction that we have creates some level of change.
I think it's important as a practitioner to understand that every patient is different. And the key, I think, of being a successful healthcare provider is understanding that even though everybody may share a diagnosis, you have to approach it very uniquely.
Oh, absolutely. Yes.
I recently did a study regarding men and women and education and chronic obstructive pulmonary disease. And it was funny because wasn't looking for it, but wound up finding out that men and women stopped taking their medications for very different reasons, because it was about adherence with medication. And women do it because they feel better, and men do it because they feel worse. So it was really odd. And I think that that's an important factor to understand too. Men and women approach things very differently.
Oh, yes.
Very differently. We're two
Absolutely.
different animals. And I think that has to be considered in care as well. Don't you agree?
Oh, absolutely. Without a doubt. And it's also an individual, too, dealing with that individual and what their mindset is.
Yeah,
Because
I agree.
I think that there's a lot of people out there that really do want to have their health again.
Yes.
Because something, there's nothing more precious than your health.
I agree.
Yeah. So, and I find that the majority of the time when people aren't willing to change, that they don't know how to love themselves.
100%.
Yeah.
100%.
Because if they love themselves, they would not abuse themselves in that manner. So, a lot of times what I'll do is I'll say, okay, do you have a grandchild? Because, we're talking
Sure.
our seniors, right? Or do you have a son or a daughter? And how would you end up treating that individual? Would you like to see your granddaughters picking up a cigarette and smoking? You think maybe she doesn't like seeing you do that?
And I find a lot of times with patients, they run and do things for everybody else.
Oh, yeah.
And they put
And then
themselves, you must see this
Yeah,
all
all
the
the time.
time.
Yeah.
And they put themselves less. And I think that that's a way to kind of mask.
Exactly.
Not
so
having to
I don't have to
face.
do it.
Right.
I don't have to do it. Here, I'll help you do it.
Exactly.
Because I want to hold you accountable, but I don't want to hold myself
Exactly.
accountable. Why would I want to do that?
Exactly. And it's something that I've been doing this for 33 years. So
Wow.
taking all this in, you learn as you go.
Yes.
And you kind of have to change your patient's attitudes and say, I heard this all before.
Yeah, yeah.
And it's funny, but you win a lot of points doing that because they want to kind of like be relieved of that hiding.
Yeah, absolutely.
And you must see that all the time.
Yes, and you know something? They feel so much better when all of a
It's
sudden they
true.
can just be real and open. And no,
Exactly.
I'm not judging them at all. But I will bring to their attention. Okay, what are you doing, and how are you taking care of yourself? And do you consider yourself deserving and worthy of that?
That's an important aspect.
And let's talk about value. Do you believe you're valuable? Maybe you should ask your grandkids. Ask your son or daughter. Are you valuable? And what do they mean? What do you mean in their life? If you cannot
that's very
take a look,
important.
at yourself and start feeling your own value and what you offer everybody,
Absolutely.
you take a look at the other side.
I would imagine from your perspective, it must be really difficult because you have to look at so many different entities. And we have a lot in common
We
because
do.
we do look at the whole person.
Yes, I'm very holistic.
Yeah, I think that's very important
Yes.
in care because they'll be great in front of you, and then when you send them back home or you send them back to wherever,
That's why.
it's a whole other ballgame.
Yeah, well, that's why they never leave my office without setting another appointment. And whatever you do not cancel on me.
Exactly.
Do not cancel because we're working, one step on top of the other. And my work, we go exponentially.
Really?
There's nothing linear about it. We're taking off.
Well, it's true.
Yeah, because we don't. Why would you want to waste a lot of time? No, we want things put together now.
But I find across the spectrum, and the age groups, people like to make excuses. Crazy. I have heard it all. I had this one young gentleman, 39 years old. He had open heart surgery, had quadruple bypass surgery.
Oh my gosh.
And we sat down with him, and I'm like, okay, you have to understand now. We have to start talking about changing your lifestyle. And I said, tell me about what you eat all day long. And he's like, I'm a meat and potatoes guy, and I love my fried eggs in the morning. I think it's unrealistic to tell someone you can't eat that ever. I'm like, okay, so let's talk about it. How about on Sundays you can have your meat and potatoes and have your stew, whatever it is that you like. I said, and the rest of the week, can we start trying a little? Introduce some chicken and maybe some fish.
Vegetables. Hello.
Oh, yeah, there was no vegetables going on. And he, in the most unkind way, asked me to leave his room. A lot of profanity was going on that day. I said, look,
goodness.
I said, I'm here to help you. If you don't want to be helped, that's fine, but I'm here to help you. I said, but I'm going to tell you something. If you continue on this path of smoking and eating the way that you do, I'm going to see you in 6 weeks. To the day.
You're kidding.
In the emergency room.
Oh,
and back
my
at it again.
gosh.
He was not happy. But,
He did it to himself.
Patients who leave and go right back out and smoke again, you can set your watch to them return. So it is a challenge, I think, on both sides.
Yes.
To take care of people who don't want to take care of themselves. It can't be just a one person thing.
No, well, something I usually say, come to see me before you create a crisis for yourself.
Right.
You know?
I agree. No, but it's true. And I think you have to be partners in care. If you're not
Yes.
partners in care with the person that you're caring for, it's going to be a really uphill battle.
Absolutely. Absolutely. Well, I just want to take a moment out and thank All County Healthcare for providing this show for us so that we can help educate you and wake you up if you are dealing with some of these issues. Okay, if you're smoking, if you're drinking, if you're overeating or eating the poor foods, you're putting your health at risk. And you know something? And there's no amount of money that can bring your health back other than you doing the proper thing. And that's the bottom line. And it's time for you, if you're dealing with those situations, call All County Healthcare. 888-717-7170. Ask for Maddie. She can put you in touch with Dr. Amy, and she can help you as well. We're all here to help you live a longer and healthier life, because with quality comes quantity. If you want to live more years,
Sure.
then you've got to add quality into your life and start really caring about who you are. And that's the most important thing.
I agree. And I think, like you said, it's not so much the quantity, but it's the quality of your quantity.
Exactly. Well, you usually find that if there is a quality of life, if you're happy, if you're,
I agree. If you're happy
active,
and you're healthy, you're active.
yeah, and you feel
just feel
useful.
better.
You're, my gosh,
And then you look
you're glowing.
better. It's true.
Yes.
I think that is a very, very big key. Attitude and how you perceive things and the choices that you make
Yes.
ultimately decide how your outcomes are going to be.
Absolutely.
And I think you see that all the time.
Yeah, and something, I hear a lot of excuses. Well, just look at this one athlete. I mean, he was in the best perfect health and he died of a heart attack. Well, okay. We all are going to, I don't know of anybody who gets out of here alive.
Exactly.
But it's up to you, the lifestyle that you want to maintain.
Yeah, but I think people get fooled into that, the media has a lot to do it. But you don't know what goes on. Professional athletes take a lot of different medications that they shouldn't be taking.
Yes.
And that causes bad things to happen.
Yeah.
I mean, recently that one, I don't watch the show, but there's that show called The Biggest Loser, and one of the health coaches had a heart attack, and he was 51. Come to find out that he was taking enhancing performing drugs.
Oh, my
that
goodness.
probably added to coronary artery disease. So you have to be careful about the way you go about doing your things.
Or viewing other people that
Absolutely.
put on this persona that they are so mega healthy and everything. And really, in all honesty, it will only provide a better life for you if you can release yourself of comparing.
Oh my God.
Because when you compare, you put yourself in somebody else's shoes, and you can't do that. You have no clue. As you so beautifully said, we have no clue what these other athletes,
No.
First of all, the damage that they do to their bodies,
Oh my gosh.
and how they overwork them often, just
And inappropriately so.
yeah, absolutely.
So
Absolutely.
I think everybody has to have your own path, and that first foot forward is the key. Reaching out for help.
How did they get a hold of you? I'm just loving talking to you. How did they get a hold of you?
You can reach me via email at ami913@aol.com. I also host a show on WNN called Two Broads from Boca, and you can reach us on that website at www.twobroadsfromboca.com, the number 2, or you can get us on our Facebook page at Two Broads from Boca.
Excellent.
There you go.
Excellent. So in case you happen to have any questions for Dr. Amy, she's been a wealth of knowledge here.
I don't know about that, but thank you for saying
we've had quite a few different specialists that have come on, and I think that's a reoccurring theme is, how are you taking care of yourself? Are you exercising? Are you eating properly? Are you reading the labels of the things
Very
that you
important.
buy and you purchase? Are you smoking? Are you drinking?
And a lot of people say, I don't understand the labels. You know what? You don't have to pay to see a nutritionist if you don't have that kind of economic situation. Go online. There's a million tutorials online to teach you how to do that. You can go to the library and use the computer for free.
There you go. Excellent. Excellent. So, what are some of the other areas that you work in? You were talking, you're teaching.
I teach
which is amazing.
Nursing students, future nurses, and that is a wonderful. It's one of my favorite things that I do. I think it's amazing. I also do a lot of research. I'm conducting a new study now regarding educating patients, so that's starting up in the works, and I just have an article up for publication right now regarding chronic obstructive pulmonary disease and education and patient outcomes. So it's pretty exciting.
That is very exciting.
It's pretty exciting.
That is
very busy. And I'm a mom of 2 teenage boys, which is very interesting. And I have a wonderful husband who's also a physician. He's a great guy. He's a pulmonary critical care physician.
Oh, okay.
So we have a lot in common as far as that's concerned. So it's good. It's good. But a lot of things are going on. And, my goal is to be the healthiest person I can be. So I want that for my patients as well. Like you.
Yes.
I mean, you look amazing, you're fit, you're beautiful, and that comes from within. So I think that
it does. And not only that, I believe that it's absolutely essential to walk the talk. If you're,
For sure.
I teach tools and techniques, how to quiet the mind, how to enhance your energy fields, how to get more in touch with your heart, how to have self-love.
that's very important in the care of yourself as well and your health as well.
Yes.
Because I think it's not only what you do, it's how you think.
It's how you feel. I also teach people how to feel again.
That's important.
Yes, because a lot of times they're not connected with the body.
No.
And the body's talking to you all the time. As a matter of fact, if there was less commotion going up here and more tangible feeling, I'm not talking emotions, I'm
Right.
talking feeling. When you feel your body, you'd be able to pick up whether or not you were doing something to harm it,
Right.
and to hurt it, or if it was working at its optimum.
I agree. And I think that that's a wonderful, service that you provide, because I think people need to understand you have to listen to your body.
Yes.
It's amazing.
And there's our music. Well, it's been another wonderful evening. Thank you so much,
Thank you for
Dr.
having
Ann. It's been a pleasure to have you. And thank you for joining us tonight. As you know, we're here every Tuesday between the hours of 6 and 7 on 1470 AM and 95.3 FM. And also airing on Tuesdays at 11 and 3 on 95.3 FM. So, and any doctors out there, if you'd love to be part of the show, please give us a call, 888-717-7170. I'm Lorena Anderson. Have a great week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.